Good job. That's a funny thumbnail. That's a really funny thumbnail. I already told Jess this, but it's very important that she not talk as she has needles in her face, right? So we're going to make sure that we don't ask too many questions of her. What's your favorite color? Wait, my bad.
Me sometimes he's like, Gilmore Girls tonight, and it's just, it brings my day. Like,
Wow.
that is words of affirmation for me. Like,
oh my god. Our guilty pleasure is Love is Blind. Hey patients, thank you so much for clicking the video. Today we've got one of my favorite reoccurring patients. She's been on this channel before, Jess. As a reminder, she's both a dancer and a singer, but she's got a new complaint. She's got jaw issues going on. As you can imagine, somebody who sings a lot, opens their mouth, that can be a bit of an issue. So today we're going to be doing the usual things to make sure that her overall wellness is staying good, but also diving into this new TMJ complaint. So if you like these videos, please don't forget to like, comment, and most importantly, subscribe. The button's right down there. It's free to press it. It really helps support the channel as well as me being able to pay rent. So again, thank you so much for clicking, and I hope you enjoy. Jess,
hi.
It's really good to see you again.
Nice to see you too.
Jess is a returning face on this channel and returning patient. She's a regular at this point. Very thankful for her. She got a new complaint going on though. She got jaw issues happening in addition to all the other stuff that we've usually been doing. So Jess, why don't you walk us through exactly what's going on with you there?
2 weeks ago I started experiencing a pain in my jaw. I've never had it before.
Okay.
I thought it was maybe that like I woke up and maybe I slept weird.
Like on it or like
yeah,
that?
like
Okay.
I have one of those pillows that is like for side sleeping and like
Yeah.
the middle is
one
like
of those
indented.
cervical pillows.
Yeah,
there,
yeah. So like I was like maybe like I don't know, something to do with my positioning
Sure,
and half of
okay.
my jaw was I don't know,
Yeah.
but
Did you like maybe bite into an apple or something, just open too wide? If you did you can't recall an individual like ow like incident? No.
you know what? I don't think I have maybe eating wise, but I do teach singing a lot.
Yeah.
And
Okay. Yeah.
and I exaggerate a lot of like movements. Like I'm constantly telling my students to like lower their jaw more so that they can like you know. So maybe
It could be a sports injury if that's the case, or
Sure.
an arts injury. I haven't heard of those before, but I guess an arts injury in this case.
athletes.
Regardless, sports are exactly professional. If you can't remember what she does, she's a singer and she's an actress as well, right? Okay, so for today, we'll do all the usual stuff we've done beforehand.
Cool.
We will get into the examination of the jaw. And we'll figure out what we can do for you. Okay.
Okay.
Listen, I'm going to pull you off that shoulder. Good. You're going to go right here. Hold that elbow for me. Good. I'm going to bring this leg right up and scooch the hips a wee bit closer to me. Good stuff. In the right position here. And I'm just going to bring it close. Good job. For those who aren't from the GTA, we had about 20 centimeters of snow just completely dump on us the other day. We got more coming this weekend too. So I had quite an influx of patients who it was their first form of exercise in a year since the previous snowfall come in with that kind of discomfort. So my low back could definitely use some work too. There you go. You got it right there. Perfect. There we go. All done.
Thank you.
Now we'll get your face down. Okay? You're great.
Thanks.
You're welcome. Compliments are free here. FYI. Yeah.
Yeah, all my friends would probably say my love language is words of affirmation.
Is that like your one and only, or are you combined between two?
No, I think I am combined.
What's the other one?
Probably quality time.
Quality time. Fair. Yeah. That must be kind of tough if you're doing long distance.
Yep.
Well, I guess it sounds like a lot of FaceTime. A lot of FaceTime.
A lot of FaceTime, yeah.
Alright.
And we've been watching Gilmore Girls lately, which is really
Gilmore
nice.
Girls.
Yes.
Sorry about that, Phil.
No, he actually likes it. He's been calling me sometimes, and he's like, Gilmore Girls tonight? And it's just, it brings my day. Like, that is words of affirmation for me. It's like, Jess, do you want to watch Gilmore Girls? Yes.
Oh my god. Our guilty pleasure is Love is Blind. I can't get enough of that. I'm going to get you to take a breath in. All the way out. Good. One more in. All the way out. Ooh.
That was a good one.
That was a really good one. Yeah.
Also, for those who are watching, it's Valentine's Day today.
That's why we're talking about all this love stuff. Just FYI. I promise I don't do that with every patient that walks in here. That'd be a really good way to get sued eventually, probably. Yeah. Okay. Let's use a little bit of massage gun here. We'll call it. Alright, so we'll get into the jaw stuff in a moment, but actually, you said it's the left side that's bothering you, right?
Yeah, like when I push my jaw this way, I feel a pain right here.
Okay, just keep the jaw neutral for a second. I want you to go ahead and just open up as far as you can for me, please. And then slowly close. Now one more time, open up again, but nice and slow, okay? Okay, so you can relax there. One thing I'm feeling with my fingers here is that on opening, Jess gets deviation, meaning her jaw moves actually to the left side, okay? Oh. Now, people don't realize this unless somebody actually comes in and feels that joint right there. Usually when we get a deviation effect, it's telling us we have an issue on one of those sides, and that's important because just because she's feeling her pain on the left side doesn't necessarily mean her issue is there. However, in this case, it is deviating to the left, so I'm going to guess that that's where her issue is too. We'll get back to that in a minute. Let's do the next stuff, and then we will actually examine the jaw more than just which side we think has an issue. Any headaches lately at all for you? You're doing okay?
No.
Good.
Ooh.
Oh, that's a spot right there, huh?
Mm-hmm.
Okay, good stuff. Actually,
Get
treat it?
Yeah.
Usually maybe once a week, once every 2 weeks or something like that. Pretty often. All right, just relax there for me. Good job. It's like you've done that once or twice, right? Yeah, good stuff. Check out the other side. That's the perk of being in the business, is that you know about 100 people who are willing to help you out at any given point in time. So. Right side doesn't feel as bad. The left side didn't feel terrible either. I think I saw you like just a few weeks ago, right?
Yeah.
It wasn't? Yeah, okay. Ooh, that was a really crunchy one. Well done.
Yeah, it was. Is that well done for you?
No, you know what? I got to give myself credit too. You did phenomenal. Well done. But you trust me at this point. So.
Yeah, I do.
Okay. All right. So we're gonna do a jaw. We're gonna get into the jaw examination here.
Okay, this is where I don't know what to expect.
That's okay. You know, new and exciting.
I didn't even know chiros could do anything with the jaw.
Oh, we do lots of stuff with jaw. Well, if the chiro is trained in it, we do. And on this channel, we do. Whoopsies. Oh. There we go. Yeah. Wait, I want it on your nose. There we go. Close enough. All right. So obviously an important tool set in a chiro's position if they're going to be working on the jaw are gloves. Okay, so I'm going to go ahead and start by putting gloves on. So there are a couple of things that I do want to check you for. Okay, now the jaw, in case it wasn't obvious, is moved by muscles that are both outside of the mouth as well as inside of the mouth. So part of the work we're going to be doing today involves me putting a finger in your mouth. Are you comfortable with that? Perfect. Okay. So first thing I'm going to do, let's go to this left side. I'm going to get you to just open up, and I'm going to lightly kind of grasp right here. Keep that jaw nice and slack for me, okay? First thing I'm going to do is press upward and try to compress that joint. Does that cause the discomfort for you or no? No? Okay. Next thing I'm going to do is actually pull down and start to gap that joint. Does that cause it at all? Yes or no? No? Okay. Last thing I'm going to do here is I'm going to try to poke at a very specific muscle. Okay, this muscle is the medial pterygoid. And I'm just going to go for it right now. If you don't mind, open your mouth for me. All right, I'm going to take a pinky. And the medial pterygoid is back there. Oh. Okay, hi. There's a big jump. Okay. So is that tender?
I mean, it like pinched, like
it
it was,
bit, eh?
Yeah.
Is that kind of where you feel, not necessarily the discomfort, but the area you feel the discomfort in?
No, I feel like it's further back.
I feel like it's even further back. Okay, one more go. Open up. Okay, and back in through. That's the area there. Okay. So the medial pterygoid has two different heads. Okay, we were going for the deeper head in that case. Let's compare that to this side. So one more time, will you just open up for me? I'm going to distract or gap the joint. That's okay. I'm going to compress the joint. That's okay. Right? And open up again. We're going to go for that medial pterygoid deep back in there. not as tender on that side, or just as bad? Not as bad? No? Okay. Generally, poking these muscles never feels good, but we're looking for jump signs like we're present on this left side. So what I'd want to do with you today, okay, based off the tone, the muscle tone and tension on this side, I'd want to actually massage that muscle out, and I'll show you how to do that in a minute. And then also we'd be doing some acupuncture through this region too. Have you done acupuncture before?
I have. Never in my face.
What are your thoughts on it?
I've only done it a few times, so I've never like experienced the benefits of it.
My patients usually fall asleep when I put it in their face. I know it's a weird concept, but
Okay.
it's true. Okay, so
Is it bad that I have makeup on? Will that affect my skin? Or
I might sanitize this area beforehand.
Okay,
Just because the makeup ever so slightly, it could be dirty, yada yada, but we want to make sure it's clean, obviously. Okay. There we go. We're going to be getting at that medial pterygoid. The way that we do that is I'm going to take a finger, I'm going to put it exactly where it was. Okay. Then I'm going to take this massage gun right here, and I'm going to hold it against the finger, and you can see that makes it vibrate.
Okay.
That's essentially how we do local vibration therapy to an intraoral muscle.
Okay.
So usually a little uncomfortable. If it's too much, you can just say stop or give me a sign or something and come out.
Okay, I'll go like this.
Yeah, you can go perfect. We're going to do that for 30 seconds, 3 sets. Okay, and you'll get a break between each every 30 seconds. All right.
Okay.
You ready for the first one? All right, let's give it a go. Open up and take this and just try to relax that mouth as much as you can. Good. That lets me get onto the other head there, and here we go. That's a funny thumbnail. That's a really funny thumbnail. 10. 20. 20. And that's 30 seconds there, first round. How does that feel? You okay there?
Good.
Good?
Thank you.
So it's not too painful then for you, huh? No? Okay. Very good. Happy to hear. Usually people are jumping off the table, so you must have a higher pain tolerance than them.
I guess so.
Right. Guys, it's really important if you're having those jaw issues to get examined for musculature issues in addition to malocclusion and dental issues. So just keep that in mind if you're ever dealing with this kind of stuff.
Okay.
Ready for round 2?
Yep.
All right, let's go. Okay. There's a probably worse spot there. 6, 7, 10. 19, 20. 27, 28, 29, and 30. Good job. Well done. No spit this time. You're in the clear.
Thanks.
So how's work? Any crushed deals lately? Are you a Disney princess yet? That's a literal question. That's not a joke within her line of work.
No, not yet.
Not yet. Soon.
But commercials and stuff. I did a Pepsi commercial.
You did a
recently.
Pepsi commercial?
Yeah.
Is it like out? Is it live?
No.
Okay.
I did it in January, so it'll probably be out
so
in a bit.
Okay.
But I get to drink the Pepsi.
Oh, that's fun.
Yeah.
That's the best part of having a Pepsi is drinking it, I would imagine.
Yeah, and then I did a Crest commercial.
That makes sense.
Which apparently is coming out soon. My family in Latin America already saw it.
Really?
Yeah.
Okay, so it's all okay. That's exciting.
Yeah.
Commercial. I keep needing to get your signature on things.
Oh.
Beforehand.
Don't you have it? You have it somewhere.
I actually do.
Like,
I have it
legal.
over there. Yeah, just for when the Chiro stuff doesn't work out.
Yeah.
All right, you ready for the last one?
Mm-hmm.
Here we go. Good, and there it is. Okay. 10. 20. 28, 29, and 30. All right. Good job. You handled that.
Thank you.
Way tougher than like 90% of my jaw patients. Usually they are crying at this point there. So very, very well done. All right. So make sure that you're always sanitizing your area before you acupuncture. That's actually a bit of a lie, guys. There's no statistical difference between sanitizing and not. But if the skin is soiled or if you have makeup on, you might want to sanitize it anyways, just an abundance of caution here. Okay, a little bit there too. sorry to ruin it. It looked so well done. You just came from a Valentine's date too.
Yeah, I was on a date with a guy who was on this channel.
She's
also
referred her boyfriend in. Yeah, she's very considerate. Yeah, Phil. You know what? Let's go ahead and link his video too. He's the one who some of you guys in the comments were saying he looks gorgeous with his shirt off. So you know,
and without glasses.
And without glasses, yeah. So you know, lucky Jess.
He was very flattered.
But
and
also
so
lucky Phil, lucky Phil, lucky Jess, right? Lucky couple.
Yeah, he's the best.
I look forward to the wedding someday. You know.
Aw. yeah.
Okay, so we're going to be getting into the acupuncture component of this now. So Jess, first thing I want you to do is to slowly open up that jaw one more time. Good, and slowly start to close. Did you feel that click there? Okay, stop right there. Stop right there. Keep it there for me for a moment, okay? So I'm going to come over here, right about there. There we go. In we go. Perfect. Okay, and you can close that jaw now, okay? Good stuff. I already told Jess this, but it's very important that she not talk as she has needles in her face, right? So we're going to make sure that we don't ask too many questions of her. What's your favorite color? Yeah, wait, my bad. Yeah. That one did not want to go in. There we go. So this needle is a little different from the other smaller ones. This one is going directly into that medial pterygoid right there. Good job. Okay. Two more. And actually, you know what? We're good with those. There we go. Okay, and now we're going to sit tight for about 12-15 minutes. So we just finished with the acupuncture there. Jess, was that particularly painful or super uncomfortable for you?
It wasn't super uncomfortable, but I did notice at one point, like I was just like licking my lips, and I felt the
you could
needle
feel
here, and I was like, whoa!
Yeah.
Like who knew that you would feel it up here?
The anatomy, even the muscles up here on the side of the head, known as the temporalis, they come down and connect into the jaw too. So if you're trying to move stuff around, it's all connected up there. Okay. I'll get you to look up into the left for me, please. We're just gonna get into some of the other usual stuff we do with Jess in here, and slowly down to the right. Good. Now you were mentioning you got some travel plans coming up.
Yeah. I was with my boyfriend today, and we were just talking about what we were gonna do for our 7-year anniversary.
That's a pretty big number. Lucky number 7.
Yeah, and we've never been traveling before.
Really?
No, we've never.
God, just the two of you?
Yeah, just the two of us. Like we've done like camping trips and stuff nearby.
Yeah, but I mean, like you're getting on a plane and you're going somewhere.
Yeah, no, we've never done that before.
Really? Okay. Why? Like, is it just cost? Because I've been dating my girlfriend for like 3.5 years, and we just went to Mexico after that time.
Amazing.
We thought 3.5 was a long time, but like 7. Yikes! Sorry about
that.
But what's the reason for that?
Yeah, just cost. Like, well, he's still a student. Like he has 1 year. Well, I guess 1 semester left, and then he's gonna do his master's.
Yeah, physio, right? He wants to do physio. Yeah,
and he's hoping to do physio abroad.
Okay.
So
that'll be traveling.
Yeah. So if he does that, then we'll for sure like go to Europe. But
some romantic countries in Europe. There you go.
Yeah. But otherwise, yeah, it's just like traveling's really expensive. But I was just kind of like.
So where would you go before that?
Well, that's what I have to figure out is like what is like a good, affordable, safe place to travel to.
Affordable, safe, worthwhile. Pick 2. Okay,
affordable and safe.
Okay. Not worthwhile though. Cuba. Sorry guys. Sorry you're from Cuba.
Anything will be worthwhile if we haven't been there.
That's a good point. That's
right?
A good point. I'll get you. See, Jess has boundless optimism. I'm not like that when it comes to travel. You should look up and to the right, please. Good, and slowly down to the left.
Yesterday, Phil and I played Mario Kart.
Oh my goodness, that's and you guys are still dating?
No. Well, we were playing with friends, and I had the remote, but I was facing away from the TV, and Phil had to direct me.
Oh, that actually sounds like a lot of fun.
It was a lot of fun, but he was like, Jess, you are not good with your left and right. I was like, oh, that's so
Well, that's a prerequisite skill for playing Mario Kart, I would find.
Well, he's like...
And just driving. Did you drive here?
Yeah, I
Oh,
drive
God.
here.
Okay.
I can do it. For some reason, I just have to think about it for a second.
But you need to, you can't wait a second. You're gonna, okay, it doesn't matter. All right.
Well, it's hard when...
Tilt right to right.
It's hard when he's like, just go left, but because I'm facing him, he's pointing to his left.
So which is your right?
Yeah, and then he's like, no, just not right, left. It's very difficult.
Oh my goodness.
But I recommend it for a fun, like, date night with friends, if anyone...
Well, there you go, Nicole. If you still watch these.
Yeah.
You remind me about this, we'll do it. If you don't remind me, I'm going to forget. Right to right.
Yeah.
On that note, for the guys, because most of my audience is men, okay? I think it's like 80-20 split.
Oh.
What would you recommend for them Valentine's-wise? What's the most romantic thing they can do for their partners? Because, like, I'm sure Phil does some great stuff for you, right? I really hope he does, because if he doesn't, that sounds like I'm throwing him under the bus. But,
I know.
Hi, Phil. How you doing?
He does do great stuff. But honestly, like, know your partner's love language.
Okay.
I think is
Define
very important.
love languages, huh?
Yeah, like, Phil and I don't see each other very often, so, like, we just use Valentine's Day as an excuse to see each other.
Of course.
Right?
Yeah.
But, like, yeah, make each other feel special, and, like, with love languages is great, because
that's how the person feels the most.
Yeah.
Special. For you guys, you don't know the love languages, highly recommend that book. Physical touch, words of affirmation, acts of service, receiving gifts, and quality time.
Yep.
You can find out what your partner likes. You do that, you'll be the best partner ever. Jess.
Yes.
We just finished up treating Jess's jaw, as well as the other things that we usually see too here. What I want to let you know is that this kind of jaw issue requires several sessions, okay? Or, truthfully, you could just wait, okay? You could wait to see if it resolves itself. Has it been getting worse over the past 2 weeks?
It was, like, when I first got it, and lately I think it's been getting a little bit more mild.
Okay, good. Good.
But we can see how it feels.
Absolutely.
And if it does need, like, more attention, like, how frequent do you recommend?
You can check back in sometime next week. I'd say if it's still getting if it's the same as it was beforehand, let me know again. That just means we might need to do it again. We might need to move the needles around a little bit, maybe potentially a little bit of a different position. But all that, I don't think it's anything serious, okay? And I think it's very manageable. That's the good news. Right?
Okay.
Do you have any questions for me before we sign off for today? Or
No.
Awesome. Well, you know how to reach me if you do, okay? Really appreciate you coming in today with the new complaints.
Yeah, thank
and
you.
hope you guys enjoyed. So if you're having TMJ problems, hopefully we can help you out too.
Yeah,
all right?
who knew?
Okay.
I didn't, but now I do. Thank you. Don't forget to like, comment, share, and subscribe.
Thank you so much, Jess.